everyone. Very warm welcome to all of you for this afternoon session on tips and techniques on health reporting. And we've got a wonderful panel of 3 speakers who are going to share their tips that, and this is really important because it's only when we learn from each other's experience, right? So whether it is how to follow up a medical malpractice or a story on medical malpractice, how do we trust our sources? Are there conflicts of interest? How do we trust the evidence that is given to us, right? Is it scientific, non-scientific? These are the issues, dilemmas that we come across whenever we write a story on health. And so it's to gain from the experience of others and how they have wrestled and solved these issues. That's the whole purpose of this session. My name is Thomas Abraham. I used to be with the University of Hong Kong. I used to teach health and science. And I write about global health programs. Most recently, I've done a book on the Global Polio Eradication Initiative. And I will briefly, you already know who what their names are, but I will briefly give a shout out to our 3 panelists, Roli Srivastava, Hristio Boytchev, and Angela Bernardo. Bernardo. And what we will do is each one of them will speak for about 10 minutes, and then we will throw it open for questions and answers. And I hope this will be as interactive as possible, because the whole point of these is that we learn from each other, right? So nothing is written in stone. I mean, these are not sort of lessons that are being handed down. I mean, this is how we build a community of practice, right? By talking to each other, exchanging our experiences and learning from each other. Okay, so without further ado, I will turn this over to our first speaker, Roli.
Hi, I'm Roli. I work with the Thomson Reuters Foundation. I'm sure you guys know what Thomson Reuters Foundation is. It's a charitable arm of Reuters, and we only cover human rights stories from across the world. We are a global network of 60 journalists. The story that I'll be talking about and the tips and techniques alongside. Can we turn this off?
Yeah.
Can we turn this light off?
Oh, I think they're filming. No? Or maybe can we get this down? Yeah, that'd be great. Can everyone see the slides? Anyway, it is black and white, so.
Not a great form.
Yeah, I think it should be okay.
Fine? Okay. So this is a story, an investigation that I did over a period of 5 months, starting last year. It got published this year. It is about a medical malpractice in India of hysterectomies. Hysterectomy is the surgical removal of the uterus, and in some cases also the ovaries of a woman. Why was it a scam? It was a scam because a lot of women in rural India were being targeted for these surgeries by doctors in private practice who were prioritizing profit over, of course, the patient's well-being. Now, this was a story that was being reported over the last many years. I myself reported on it about a decade ago from a southern Indian state where hysterectomy was found to be rampant across several villages. Followed it up for several years, so did several other journalists in India. And during one of these stories in 2016, found out that the Indian government was for the first time collecting data from women across the country, asking them, do you have a uterus? So that data was widely awaited because this was the first time that the government was going around collecting information on whether or not Indian women had a uterus. So for 3 years, I was waiting for the data to come out. It came out last year, and this was the headline of the story which came out, that private doctors were performing most of the surgeries. Now I had the data. I'll move to how I analyze the data, which is also fine. So first was the numbers, because the sample size of the survey was very small. The government had interviewed just about 700,000 women, which is 0.7 million. In a country like India, where there are more than 500 million women, 0.7 million is hardly a database. Of that number, just about 3% had undergone a hysterectomy according to the government data. 3% of 0.7 million was, there were no alarm bells ringing as far as the figures were concerned, because that was just about 21,000 women in an entire country as big as ours who had undergone the procedure.
I'm sorry, I have no idea what's a hysterectomy.
Hysterectomy is the surgical removal of the uterus.
But why?
Okay. Due to, a lot of postmenopausal women have health complications, gynecological health complications, for which a hysterectomy is advised. I'm coming to the point on why it was a medical scam. So it's the removal of the uterus. In some cases, it is accompanied with the removal of the ovaries as well. It's called a complete hysterectomy in that case. Okay, so the pattern. So the numbers were a dampener, because the sample size was small and 3% was absolutely a dampener. But the patterns in the survey were interesting. So what was the age group of the women who were undergoing this procedure in India? So that was 15 to 49. This 21,000 figure was of women in the 15 to 49 age group. What was the socioeconomic status? Again, the survey threw up a great picture there, because most of them were from marginalized communities of India. The data, I analyzed the data with a health expert who was on board through this story. Who was doing this, who was performing these surgeries? Again, the data showed it was being performed by doctors in private practice. And where was it being performed the most? It was in rural India where it was being performed the most. So there was a pattern that emerged which had many alarm bells ringing. One was the age group of the women. The health experts in the country said that hysterectomies are common across the world. India is no exception. But it's the age group of women who are going for it which is a concern. And that most of them are in rural India. Also, the other indicators that the data threw up was most of them had never been to school. The women who had undergone the procedure were not literate. They were from poor families. So it showed that the patients were clearly not aware of what they were going for. Now I had to follow up on the story. The data helped me identify which Indian states will I be visiting. If you're familiar with the Indian map, so that's one state, Telangana, which was shown as the most, where hysterectomies were the most rampant. So I started with Telangana. Maharashtra and Rajasthan, I went to those states not because the data said that they were they were high hysterectomy rate states. I went there because there was anecdotal evidence of high numbers of this surgery being performed in these regions. Overall, I went to 12 villages in 3 Indian states to meet women over there, and found one family where 3 generations had undergone the procedure: the grandmother, the mother, and the daughter. And then a woman who was just about 20 years old who had undergone the procedure, and another family in another village in Rajasthan where just about every woman had undergone the procedure. And then, but what was I trying to establish? The medical malpractice was already established in the country. It was a decade-old story, just that the data was new. But we didn't want to stop at the data. When I'm saying we, as in at the Thomson Reuters Foundation, when we discussed the data, we didn't want to stop there, that these are the findings, and are we going to stop here? And we went back to the women with a very basic question: what's life like after surgery? You've been operated upon possibly about a decade ago, possibly 5 years ago, or just last year. So what's life like after your surgery? I'll just play a small video.
నా పేరు బూటి. నేను కౌలంపేటలో పనిచేస్తున్నా. మాది షేరితాండ ఇది. ఈ షేరితాండ నాది ఆపరేషన్ అయింది, తెల్లబట్ట పోయిందని ఆపరేషన్ చేయించిన నేను. ఆపరేషన్ చేయించిన డాక్టర్ దగ్గర పోతే ఆపరేషన్ చేయాలి అని అన్నాడు. ఈ గోళీలకు మందులకు తగ్గదని చెప్పిండు. అయితే పొద్దుమికి వచ్చిన పొద్దుగల ఆపరేషన్కి పోయినా. అయితే పైసలు లేదని అంటే టెన్షన్ పడ్డామని అంటే మా సార్కి ఫోన్ చేస్తే మా సార్ ఇచ్చిండు పైసలు, 50,000 ఇచ్చిండు. 50,000 ఇస్తే నేను ఆపరేషన్ చేయించిన. ఆడ పని చేసి తీరుతున్నాం మేము. పైసలు తీసుకొని తిరుగుతున్నాం. మా వాళ్ళు కూడా మా తండలు చెరి తండలో కూడా 50 మందిలో ఒక 10 మందిలు కూడా వాళ్ళు కూడా చెప్పించారు, ఆపరేషన్ చెప్పించారు. వాళ్ళు కూడా చెప్పించారు. కానీ ఇప్పుడు పైసలు లేదని మాకు బాధ అవుతుంది. ఇప్పుడు ఎట్లా తీర్పాలి, పోరళ్ళకి ఏం పెట్టాలి అని బాధ అవుతుంది ఇప్పుడు.
So now I'll tell you why this was a medical scam. Women as young as in their early 20s, late 20s, if they had abdominal pain during their periods or they had excessive bleeding during their periods, they had white discharge due to an infection, the first suggestion that the doctor that they were visiting was get your uterus removed. Now, why are periods a problem in India? Because there is a taboo attached to periods. You can't enter the kitchen, you can't cook, you can't, there are several things that women are not allowed to do during their periods. Also, any kind of a discomfort that comes in the way of work. These are poor families who depend on farm labor for their daily earnings. So their daily earnings would be what, 200 to 50 rupees a day. That's less than $4. So if you're not able to go to work for one day, it's just cutting off that day's salary. So periods are a problem. So anything that comes in the way, it could be excessive bleeding or vaginal discharge or anything, and they visit a doctor. So instead of prescribing medicines or antibiotics or counseling the women on hygiene, on menstrual hygiene, etc., the doctors simply say, just get your uterus removed, because the doctors are looking at cashing in on this ignorance and making money out of it. And that's why this is a medical scam. But after this interview and multiple similar interviews, there was a common thread that emerged, which was the financial distress that these patients were under following the surgery. So for a family that's earning $4 a day to fund a surgery that costs them $1,400, like 100,000 rupees, how do you raise that money? How do you overnight raise the money? In this case, she said she visited the doctor and he said, you must undergo the surgery tomorrow. So within a day, where will you get the money from? Which bank is going to process your loan? So the first person you will contact, the richest person you know in your village, is the farm owner where you work. So they approach the farm owner, who gives them the money. What she does not say here is now that the husband is working on that farm to repay the loan, and that's what's called debt bondage, when you're repaying money for a loan for a cash advance that has been given to you. In India, it's said that you are just one health emergency away from slipping into poverty, because we don't have the social security of first world countries. We depend heavily on private health care. And because of that, the expenditure on our healthcare is huge. Like one day at a 5-star hospital in the ICU would just drain you of 100,000 rupees in no time. And these are poor people, so they had taken loans and they were now repaying the money by working for the money lender. And this is where the story turned into a health scandal in India that's enslaving rural families. So from a health report, it turned into a human rights story. Of course, the basis was the health scandal. These are both tips and techniques and how I kind of figured out this story, because it was no longer a health story alone. It was about a larger problem of debt bondage. So the obvious picks, of course, were like I spoke to as many patients as I could. Like I said, I visited a dozen villages in 3 Indian states. I visited the clinics where the procedures were being performed, met health experts. Health experts were very important through this story because I had to verify everything that the women were saying. And of course, the India's health ministry, who came in later in the picture for the mandatory official codes and versions. But beyond health, I had to tap other sources to build the story of financial distress, which were local NGOs or charities in villages, which were not working on health or women's issues or anything. They were possibly working on groundwater or the scarcity of, on girl child education, for instance. But they had contextual understanding of the village. They had an understanding of the milieu. They could take me, and they had a language understanding. You speak multiple languages in the country, you need language help. You need somebody to translate. Then lawyers. Why lawyer? Because during my research, I found there was a court case pending in India's top court, asking the government to compensate these women who have undergone hysterectomies and taken huge loans for it. consumer rights activists and labor rights campaigners. And there's a lot of crisscross over here because the patients put me on to the consumer rights activist. Apparently, the consumer rights activist had visited the patients at some point a few years ago. So that's how I went to the consumer rights guy. The consumer rights guy put me onto the lawyer who had petitioned the Supreme Court with his information. So there was a lot of crisscrossing of between these obvious picks and the Beyond Health sources. The best, though this was not crucial to the story, but it was important to show where these operations are being performed. This was in the residence of a doctor in one room converted into an operation theater. This is what the OT looked like. The doctor was sleeping when I went there because it was his residence, just that the operation theater was fortunately open for me to take a quick picture. And when I spoke to him later, he admitted that a lot of hysterectomies are performed in his clinic, and I asked him why young women, because he said, if I don't, somebody else would perform the surgeries. There are multiple private clinics dotting India's countryside. So in the absence of a public healthcare system, a good public healthcare system, this is where a lot of women go. The story had an impact because the Indian Health Ministry reached out to every campaigner, every health expert that was quoted in the story, and formed 6 task forces, which are now looking at creating awareness in villages and creating a protocol that no hysterectomy will be performed without the approval of a government doctor. Yes. And the health officials finally, who had so far said, like even for my story when I had spoken to them, and they had said that this is a complex problem, women go seeking this help from doctors, and the doctors are not to blame. But finally, after all the health experts went to Delhi and there was a national consultation, they finally conceded that 90% of all hysterectomies are unnecessary in India. And these were my learnings, and I'm just sharing them with you, that explain reason. For each of my interviews with the women, I explained this reason for doing the story. I took their consent, which was very important, that I'll be using your picture, I'll be using your name. Are you okay with that? Will you get in trouble with your in-laws or anything? I took their consent. The best case studies, of course, came off camera. Verified details of all the patients, took their details, age, etc., from their social identity cards, verified all their medical documents by taking pictures of their medical documents and showing them to a health expert to ascertain that the woman indeed underwent this procedure. Like I said, got local community help in terms of charities, always kept patients' convenience in mind, because I was visiting families that are farm laborers, and I couldn't have gone at a time when they are on the farm or they are busy or anything, so I had to time my visits early morning or late evening. So that was another, and always came back with their phone numbers because I had to call them back for clarification. So that was my main learning. So that's all. Thank you so much. Thank you for your time.
Thank you very much, Roli. And over to you, Hristio. We'll do the questions afterwards, but if there's some urgent clarification, as there was here, please, if there's something that you don't understand,
Maybe I missed it, but what was the financial incentive for doctors to prescribe hysterectomy?
Oh, yes, I should have said. So, the procedure costs somewhere around anywhere between 30,000 rupees to 100,000 rupees. 100,000 rupees is around $1,400. So that's an incentive. It's a business. You're prescribing a surgery, you're performing a surgery to make money. Yeah. Yeah, so the more surgeries you perform, the more money you're making. And these were, among the women I interviewed, one had undergone the procedure at 18. So, yeah. Okay.
Yeah, I think we'll wait till, just hold your questions, note them down, and then we will come back.
Hey, so thanks for this opportunity. I was thinking a little bit about what should I talk about at this conference. There are so many more experienced investigative journalists here. So I come from a more traditional science and health journalism background and moved into investigative journalism. So I'm gonna just speak more from the perspective of health journalist. What if you want to, as an investigative journalist, move into that field? What would be tips that I would give you? I don't know. Show of hands. Who was at the other session? Tips and tricks 1 in health. Okay, so you've seen this. How many people are not familiar with this? The pyramid of evidence. Or is everybody familiar with it? So I won't explain the whole pyramid. It's just something to always have in mind, basically. I can only say that this is very important. You should know that it exists, and it basically describes. So at the very bottom, which is impossible to read, obviously, it says there case reports, opinion papers, and letters. And actually, if you want to make it more modern, tweets and expert opinions. So this is at the very bottom of pyramid of evidence. Okay. Doesn't mean that it's wrong. So it can give you a great clue, but you have to find out if it's true and valid. You have to move up the pyramid. And so in yellow, randomized controlled trials. This is kind of the golden standard of a trial in medicine. I won't explain it. You should know that it exists, and you should know that you should understand what it is. And at the very top, meta-analysis and systematic reviews. These are basically studies that combine many different papers into one, and so they have the most weight. So always have this in mind if you report findings or some effects of drugs and so on. And such things there are explained in different places on the web. One of my favorite projects for quality health journalism is healthnewsreview.org. They have great resources for covering health. They explain a lot of things, how you should read a paper, how to understand it, what is important, and so on. So, and they also explain this very well. So just to know that these things have been explained very well. So we decided to go to tips of three tips to boil it down. So my 3 tips are gonna be always be careful. Because I've had the experience that a lot of investigative journalists, when they kind of move into this field, they kind of roll over some things that otherwise health journalists are very sensitive about. So one thing, be careful with contrarian whistleblower scientists. So, you know, an investigative journalist loves the whistleblower, right? So this is what you want to have. You love to get this whistleblower who is going to help you uncover this great conspiracy, right? So in science, there are also so-called whistleblowers or contrarian scientists, for example, right? So, but in science and you know, medical science often work in another way. So there's a reason for contrarian scientists to be a contrarian. So usually, most of the times, the majority of scientists is going to be correct, and the contrarian is going to be wrong. And if you one day are very lucky and you discover this contrarian scientist who is right, you're very lucky, but most of the times, he's going to be wrong. So have that in mind. Think of Wakefield, who wanted to have proven that there is a connection between vaccination and autism. Think of Seralini, who produced these mice with these tumors to prove that GMOs cause cancer, which of course was complete bullshit. But he even got a whistleblower award for that, next to true whistleblowers. Climate deniers, think of climate deniers. And once again, it boils down to this. Expert opinion, very low on the pyramid. Can be true, can be false. You have to move up to see if there's something to it. Tip 2 is similar. So be careful with patient anecdotes. So what's, classic example, what's the plural of anecdotes? Of anecdote? It's not data, right? So, we love journalists, we love this dramatic patient anecdote. Somebody, had this treatment, suffered greatly, great story. You want to make this kind of out of it. Well, correlation is not causation. So it doesn't mean necessarily because there's this one anecdote of somebody taking a drug and dying that this was caused by the drug. And also medicine is a field where these things are bound to happen anyway. So medicine is full of adverse effects. So there would maybe have been an adverse effect anyway in some other case. Once again, this is down to this pyramid. So case reports, very low on the pyramid. That's the anecdote. Can be true, but you have to move up. You have to substantiate it if there are studies showing what you want to show. Tip 3. So once again, also be careful. This time with protagonists and your readers. So, in medicine, it is a special field, again, for investigative journalism because the protagonists very often are very vulnerable, the patients. So, you always have to think what you want to do to your protagonists. So do they, how do you want to talk to them, especially, for example, if they have a mental health issue? How is this going to affect them if they're on TV or newspaper? Is it really worth it? Do you really need them? So, really protect your protagonists. Maybe sometimes you're the only person actually protecting them. Sometimes you have to protect them against their will. And also protect your readers. So imagine, your mother who has a certain disease reading about the disease you're covering. I would just say that. Are you conveying the correct information in a correct way? And so there are many, tips on how to do this. In once again, Health News Review. We have also a German version, and I'm a member there, and the boss, Professor Wormer, is in the back. So we have a German version. But so this is one of the most important quick categories that I want to tell you. So who is aware of what is absolute risk and what is relative risk? Okay, so I'm going to quickly explain it. So very often you read, a certain intervention, let's say, increases. So a certain substance increases breast cancer by 50%. Increases breast cancer likelihood by 50%. Well, what does it mean? Well, mostly it means that there's a natural chance of a woman, let's say, to have breast cancer, and it's, let's say, 4%. And this 50%, it's then 4% and additional 50%, so it's 6%. So it's actually only an absolute risk increase of 2%, but we write 50%. And this is very important. So you should always use absolute risk, because this is what actually people understand, and this is the correct information. But of course, 50% sounds much nicer than 2%. So we usually write 50%, which is wrong. These were my 3 tips. And now some just general story ideas focusing on hospitals, because Angela is going to talk about pharmaceuticals later. So, one idea would be to get some sort of quality of treatment data. So one example here is ProPublica, who analyzed, how successful different hospitals were in certain surgeries. Positive outcome versus adverse outcomes, and compared them, and they found out which hospitals and which surgeons actually do especially poorly. So can you get this sort of data? And can you make a story where you show that some certain hospitals or surgeons or other practitioners are doing especially poorly or badly? That would be one idea in your region. Another source of data story idea actually connects very well to what Roli explained. Quantity of treatments, just quantity, comparing quantity. So this is a project, for example, the picture is a project of colleagues of mine, Science Media Center, and they are looking for differences in how often certain interventions are performed. And then you can find, okay, so in certain regions, certain interventions are performed much more often than in other regions. So what does it mean? Well, it can have explanations like age or whatever, but sometimes it doesn't. So is there a certain hospital that overtreats for a certain intervention? Find that hospital, why are they doing this? Also unusual treatments, like some very weird old treatments. Is somebody still performing them? Why are they performing them? Can you find this in the data? Or also the opposite, like very low numbers of interventions, also a project of my colleagues. Well, if there's, if you find a hospital that performs a certain surgery 5 times a year by one surgeon, well, most likely this one surgeon that performs the surgery 5 times a year, he's not going to be very good. He's not going to do a great job. Can you find that? This is a story I did. Alternative medicine, it always works. Always works. There are charlatans everywhere in the world. So this was an undercover research. So we, with a colleague, pretended to be cancer patients, went to alternative healers, alternative doctors, and they proposed to us crazy things that would have killed a real patient. Always works. There are these people, patients basically are desperate, and this market exists, and I think in every country. But here, when covering this, 2 tips, ask the systemic question, so who is to blame? Well, the doctors are to blame, the witch doctors, but also the regulators, so why can't they protect patients from these clinics or these doctors? And also here, be careful not to blame the patients, also compared to what we heard in an earlier presentation. Yes, sure, the patients agree to this, but why? So patients are very vulnerable. If you have cancer, you're going to be very vulnerable, very scared. You're going to maybe try everything, and then there's this very charismatic doctor trying to convince you. So, try to understand, not to blame, and need to see the patient here. Yeah, I'm wrapping up. So some other story ideas, we heard this also, where to find them. Patient organizations, of course, obviously. Patient groups on social media are great, Facebook especially. There's a lot of chit-chat on Facebook. It has helped me in several times. And of course, patient lawyers are great. And a final tip, so collaborate. I would argue that much stronger stories can develop if classic investigative journalists work together with health and science reporters, just to get ideas, what is going wrong, but understand this and use the skills of the other. So this is an example of an investigative journalist and a science reporter working together for Süddeutsche Zeitung. And just a brief advertisement for collaboration. So basically, I'm working together with a colleague on a database for conflicts of interest that we're going to hear about later, what are conflicts of interest and why they're important. So basically, we're looking for collaborators. So if you want to research this and get ideas for topics in your country, we're basically mining conflicts of interest statements from scientific journals, which is a worldwide topic, so every country is covered there. So if you want to collaborate, please chat me up or write me. Thanks.
Thank you very much, Hristio, for that wonderful introduction to, well, evidence-based medicine, but evidence-based medicine also can lead to evidence-based journalism. So thank you very much. And with that, I call Angela for...
Thank you. Hi everyone, good afternoon and thanks for attending this session. Thanks so much for your kind introduction and Hristio and Roli for your talk. They have been wonderful. I'm gonna explain an investigation that we at Civio carried out during the last 2 years related to conflict of interest. Civio is a non-profit newsroom based in Madrid. We are a small team of 10 people. We are an independent and non-profit organization that conduct data-driven and cross-border investigations in different areas, for example, public procurement, justice, environment, or health. And regarding the healthcare sector and public policies, I put this slide here because we are part of different international initiatives, such as the European Data Journalism Network. And I put this slide because we are working now in a big investigation related to healthcare that will be published in a few months. So stay tuned and pay attention to our website. We at Civio have conducted several investigations related to healthcare. We don't cover any breaking news related to healthcare. We don't cover the new scientific article published in Science or so on. We try to cover problems related to science and medicines. And in this case, we conducted 3 different investigations related to access to medicines, access to vaccines, and access to contraception around the world. And I'm going to talk about our last investigation, which is related to conflict of interest in the pharmaceutical industry. I don't know if you know what is a conflict of interest. It is a situation where the professional opinion of someone, that could be a doctor, for example, may be influenced by other interests. For example, financial gains, which is the most popular conflict of interest, but also they could be affected by friendship, by political beliefs, and so on. But in this talk, I will focus on conflict of interest in the pharmaceutical sector, because we have data to analyze it. We don't have data, for example, specific data to analyze the conflict of interest with other sectors, for example, food industry and chemical industry, and that's why we decided to focus on this conflict of interest in the healthcare sector. So we know that there are close relationships between the big pharma, between pharmaceutical companies and public universities, hospitals, and doctors and scientists. And these relationships are because of in order to develop new medicines. However, there are a lot of doubts related to the personal transfers of money, because these financial gains, these financial transfers could affect the professional opinions of doctors and scientists. And for that reason, this conflict of interest could affect also biomedical research and the clinical practice. So we decided to cover this topic because there is a considerable lack of transparency, also in Spain. In our country, this is an underreported topic, and we strongly believe that there is a need to freely access information related to conflict of interest, not only in medicine, but also in research. So my first tip when I started an investigation related to conflict of interest is study and understand the regulation, the law. I know that you may be interested in covering health and medicine, and laws sounds boring, but it is really important to understand the regulation in your country, but also in other regions, because it could provide you not only data, but information to compare the problems in other countries. So for us, in the case of the United States, I don't know if you know that, but there is a specific regulation by the public administration that enabled the creation of a public database, which is called Open Payments, and there you can search for any doctor to know if he or she has received money from the pharmaceutical industry. So that was the reason why journalists from ProPublica and New York Times discovered that Josep Baselga, a very well-known scientist from Spain, but he was working in New York, he had received a lot of money from pharmaceutical companies. However, he didn't properly disclose his financial ties with the pharmaceutical industry. However, the situation in Europe is quite different. I don't know if the colors are well seen, but in green we have the countries that have a specific regulation about conflict of interest. In this case, for example, France, Belgium, or Denmark have specific laws to publish the transfers of money from the pharmaceutical industry to doctors. However, in Spain, for example, we have a law related to transparency and access to public information, but we don't have any regulation related to conflict of interest in the healthcare sector. Even though the Spanish doctors are receiving a lot of money from the pharmaceutical companies, much more money than, for example, the German doctors. And Germany is bigger than Spain, and the German pharmaceutical industry is bigger than the Spanish one too. So after you know which is the regulation, you can know the sources to get the data. For example, in the case of Belgium, that has a specific regulation by the public administration, there is a public database where you can search for any doctors. It's the same case as in the United States. In the United Kingdom, for example, the pharmaceutical industry publishes a private database where you can search also for any doctors, and this is a common database. And in other countries, for example, in my country, in Spain, as we don't have any regulation, you have to search for every publication of every laboratory in order to know the transfers of money from each pharmaceutical company. So it's quite challenging to know all the conflict of interest between the big pharma and doctors there. So you have to go to the website of every company. This is the case of Novartis, which is a famous pharmaceutical company. So we have to search for every report in the case of all the pharmaceutical laboratories and download all the data and analyze all the payments, all the transfers of money. These transfers of money could be related to direct payments. In the case of honoraria, for example, if a doctor has been invited to a conference and has given a talk, but also if he works as an advisor of the pharmaceutical company. And you have the indirect payments, for example, if a doctor or a scientist goes to a conference and they paid the travel and the stay and so on. But remember the first tip about study and understand the law, but also be aware of possible changes in the law or in the understanding of the law. Because here, this photo is a report of the Spanish Agency of Data Protection that said in 2017 that all the data about this conflict of interest in Spain must be public, because the public interest was much more important than the data protection of these doctors. So before 2017, Civio published several stories related to the transfers of money from the pharmaceutical companies to doctors. However, we didn't know all the payments because because doctors had to because doctors could refuse to appear in those public files. In 2017, we could publish all the information about all the payments, and we discovered that 18 doctors receive high amounts of money from the pharmaceutical industry. So my second tip is related to provide the big picture, to provide the context to your readers, because money is important, but so it is its impact, its influence. So you can ask, for example, are only doctors affected? There is an impact on biomedical research, on medicine. So we published several stories related to the transfers of money from pharmaceutical company also to the patients' associations, to the public hospitals and universities in Spain. And we wanted also to focus in the lack of transparency. So we, after publishing this story about the 18 doctors that were receiving a lot of money from pharmaceutical companies, we decided to search for their scientific articles. There are a lot of websites where you can search for scientific articles. We use PubMed, which is a very important one. And it works like Google. You can search for any scientist or for any study, and also filter for the study you want, and access also some of the articles. But in case that you have to pay for accessing an article, you can use this tool, StudyHub, which is another tip to do this kind of research, and search in every article for the section of conflict of interest. Sometimes it is in the first page of the article, sometimes it's at the end of the article or in a separate file. And we publish another story related to these doctors that weren't properly disclosing their conflict of interest. And my third tip is you have to be sensitive, because health is a very sensitive topic. But also you have to be critical, because you shouldn't forget that you are a journalist. So we publish a third story related to not only the lack of transparency, but also the risk of bias, because we discovered that the doctor who received the highest payments in Spain from one single pharmaceutical company, he received a lot of money from Bayer. Bayer develops 2 important treatments against liver cancer. He's an expert on liver cancer. And he strongly recommended this treatment, but he didn't disclose his conflict of interest with Bayer. And also these treatments are surrounded by a big controversy in the scientific community because of their price and toxicity. So it was really shocking to publish this, but it's a situation that also happens in medicine. So my 3 tips in order to conduct an investigation related to conflict of interest is know the law, study and understand the regulation. The second one, to provide the big picture, the context, not only to focus on the money. And the third one, don't forget to be clear, to be rigorous, but also to be critical. But also don't forget that health is a very sensitive topic, as Hristio said before. So thank you very much.
Thank you very much, panelists, for 3 wonderful presentations. So can I invite you all up? We'll have a question and answer session. And when those of you from the audience who are asking questions, please use a microphone because, hey, we're being live streamed. We're on TV. All right. So, yeah, go ahead.
Yeah, hello. My name is Katrin Gräbner from German TV station. I'm working in Berlin, and I'm getting every week, I'm getting an invitation to a press conference from something about health, about, how do you call them, Krankenkassen, whatever, a lot of studies coming up. So I have this theme every week to decide, is this press conference worth it or not? But I have a question about this pharmaceutical, the last part you said. The payments pharmaceutical industry gives to doctors and to clinics, and big issue, I think, to universities. Is there any, and that's maybe an answer you can give all of you, is there any research area where you think, do they have to tell anybody, the pharmaceutical industry, or, I mean, in universities, I mean, you must find something, I think, where the money went through or what money went through. But with the doctors, I mean, that's really nice to know.
I mean, I can say about Germany briefly, but we did a very similar project, like Civio, Angela. I was formerly at Corrective, and we did this database of conflicts of interest of doctors based on the same data, but for Germany, right? So, and there, we've had 2 editors-in-chief since, but still this project works, so you can actually look for a doctor there and see what he or she has given, which information. It is voluntary statements, right? So only 25% of doctors have given this information for the years 2015 and 2016. But another way to, of course, find conflicts of interest, and as also Angela mentioned, are scientific papers. So if it's a researching doctor, right now you can go to PubMed and or to Ärzteblatt, and you can look if they have a publication there. And then most medical journals require you to say whether you have a perceived conflict of interest, so whether somebody pays you to be whatever on a committee or whatever. So that's a conflict of interest, and separately from whom you have received funding, so research funding. So these are the 2 things, they're a bit separate, right? So you can get this information right now by hand in PubMed. And just to, once again, for the last time, plug my project, we are building a database from many journals and many authors, where I hope and we want to give this to the journalists within the next months. So if you're interested in this, write me, where you can look for certain scientists or medical doctors or whatever, and it will tell you whether in any of these papers that we have collected, they have given a conflict of interest statement. I think that's the status now that you can research with.
In the case of the pharmaceutical industry, they publish these numbers because at the European level they adopted and kind of ethical code to publish these transfers of money. That's why in countries that we, for example in Spain, we don't have a regulation by the public administration, but we know the transfers of money because the European pharmaceutical industry adopted this code. That's why in the food industry or chemical industry and so on, they don't publish the numbers. In the case of R&D related to universities, public hospitals, and so on, they aren't specific about the funding of research projects. They publish like a sum of money, but they don't say, okay, this money goes to this doctor or to this scientific group. So you know more or less what they are spending, but know in which projects they are paying money. And in the case of scientific articles, I totally agree with you. The problem is that there aren't common guidelines about how to disclose a conflict of interest. So every journal publishes like a guideline about, okay, you have to publish your conflict of interest, but at the end, the decision is made by the own author that have the conflict of interest. So it's like, yeah, a little bit problematic. Thank you.
Roli, can I ask you, obviously the EU has got very strong laws and there's a lot there's a lot of transparency. In India, how would you deal, where would you even begin to look for conflicts of interest? Is there any record of payments that the pharmaceutical industry makes to doctors being taken on trips for so-called conferences? Is there any record of any of this?
There wouldn't be any official record of it. But yes, there are these, again, anecdotal evidence of doctors who are going on various pharmaceutical trips or, you know, all their vacations abroad and everything. But there's no official record. It's not that you can tap a source and tap an official government data and get that information out, no.
It's really important, I think. The gentleman at the back.
Hi, thank you. I have a question relating to the research on hysterectomies. I was wondering, because you said it was sort of a 10-year-old medical scandal, it was well known. Are there any clues, or do you have an intuition that there are other procedures that are going on in the same way, and which, and how are you proceeding this?
So this was, though it's a decade-old scam, but it's a developing story. Even now, the government is not acting on the private clinics or putting the doctors or whatever behind bars or not doing anything. But the other procedures that are often cited as being performed unnecessarily are cesareans, for instance. When a woman is in labor, the doctors do not wait for the woman to give birth naturally. They suggest a cesarean because they earn more money if they're performing a cesarean. So that's another one. Yeah. That's the same in Germany? Okay. Yeah.
Thank you very much.
And actually, in this case, in the case of cesareans, there is evidence because the WHO has got a recommended or the normal level of women who undergo a cesarean, and India is way above anything. So, but once more, there is data to back this up.
Corroborate that.
Yeah. The lady over there, and then the gentleman at the back.
No.
Yeah, you first, and then.
So I'm Viola, I'm from Italy, and I was investigating abortions in Italy because it's a huge deal over there. I mean, everywhere actually. But, and the thing that I realized that I'm having a lot of difficulties with is actually getting the doctors to talk, because like they're the ones who are in wrong in this case, and just like the hospitals won't answer. You can't really just turn up there and force them to talk to you. So I was wondering if you had any insight on how to like build a relationship on that side, if there's any way through around it that you could suggest, and so on.
That's a question from it. You're from Italy, right? And what are the abortion laws there?
Basically, it's legal, but every doctor can object to it out of conscience. And so like 70% of doctors don't do it, and we justify it by saying it's their conscience, but everyone knows it's not, and it's just that they're being bullied by their superiors
please.
into not doing it.
Use the mic, please.
Sorry, did you hear all of that?
Yes, I did, yeah.
Did everyone hear all of that? Okay.
Yeah.
Do you want me to repeat it?
Repeat.
Okay, I was saying that in Italy the deal is that abortion is legal, but since there's a clause in the law that allows doctors not to perform it in case of conscience of conscience, yes. 70% of doctors nationwide don't do it, and it's not actually, everyone knows it's not actually a conscience case for most people, but it's just that their superiors at the top of the hospitals have links with like the church or with associations that are very Catholic, and so it's kind of a peer pressure not to do abortions, because otherwise you're just gonna be stuck doing abortions and you're not gonna grow from a professional point of view. So it's a huge deal.
Oh, okay. So you're looking for doctors and clinics that are saying no or are saying yes to abortion.
I'm looking for the ones who are not doing the abortions.
So I would suggest that the hanging fruit in these kind of investigations would be the people who have been denied the service. So how do you track them? If there are groups, it could, I don't know about Italy because never reported from there, but if there are any support groups, say for instance of victims of sexual assaults and all, and if they have approached a clinic or a doctor, if there are such support groups, and if they've been denied a service, so that's possibly one. If there are any gender groups working out of Italy and are working on reproductive rights of women, that's another go, if you've not tried it already.
Yeah, the thing is, I already reached that. I already hit that wall. The only thing that I'm left with is having to talk with the doctors, and I'm just not managing to.
I would add that in that case, as I understand, actually the doctors there would be some doctors that want to perform abortion, but they can't. I think in this case you could try with anonymity. Right. So obviously, there must be doctors that they think the system is wrong. They are afraid personally, so they won't talk to you on record or whatever. But if you grant them anonymity and collect some of them, this could be a way.
Fair enough. Okay. The gentleman at the back, and then
yes.
Time for one last question. That'll be yours.
Thank you. Holger Wormer, Dortmund University in Germany. I would just, first I would like to add another tip concerning the investigation of conflict of interest. Hristio already said when you just going via Google, conflict of interest and then a certain doctor, but if you have a certain connection found with some pharmaceutical industry and a certain doctor, just continue with these two names, and then you will see if a doctor you get, for example, conflict of interest, you get a doctor and buyer company, and you just continue with buyer company in the name of the doctor. And this very often it brings very interesting results. So it's just another tip or just another comment. But I have also a question. In Germany, the basic idea is that clinical research is funded by industry. So most of clinical trials that we have in Germany, by nature, are funded by industry. So what's the situation in other countries? So in your countries, what's your situation in Spain or in India? Is most of the clinical trials, they're also funded by industry, or is there also a certain amount which is funded by the government or public money? Thank you.
I don't have a specific data of clinical trials in Spain. It's a topic that we like to explore, but we haven't started to do it. But many of them are funded by the industry, because at least they choose different hospitals and different doctors in order to conduct these clinical trials. But we know that some of the doctors are receiving money to conduct these clinical trials. However, in the publications of this conflict of interest that I mentioned, the problem is, at least in Spain, we know the numbers, but we don't know the situation when these transfers of money are happening. So we know these direct payments from for honoraria, or these indirect payments, but not if these transfers of money are related to the to carry on, for example, a clinical trial or not. So we don't know the exact numbers. I don't know in India.
Yeah, in India, industry and some clinical trials, even by the government, I think you will be able to corroborate that. Yeah, but yes, industry plays a big role in, has a large share of the clinical trials, yeah.
And actually one of the bigger problems in India is that global pharmaceutical companies are conducting their clinical trials because it's easy to recruit patients. And in Africa and Asia, this is very widespread. And then there are huge issues when you take people from poor backgrounds who very often don't have high levels of education, then where does the question of informed consent come in? So there's a whole, and then the whole issue about the clinical trials registries, how well are they maintained? So we have a double, yes, there's some very little government, largely private, but more important, it's global private trials that are being conducted in countries like India, mainly because of the ease of patient recruitment.
I'll just add to that, sorry, of course, a large part of clinical trials being conducted on a large population with the placebo, and as in to check the impact of a drug and all that. But then there are the other clinical trials that patients who are at the, they are terminally ill and they are enrolling themselves for it. So that's happening at the tertiary care hospitals of the country, like particularly in oncology, in cancer care, where there's just no hope left. So then they are themselves voluntarily enrolling themselves for ongoing clinical trials globally, and they want to be the drug to be tried upon them from India.
The lady in front, and unfortunately this will be the last question because we have very strict instructions. We need to finish on time. So,
hi, I'm Nina from Switzerland. Since you were referring to Switzerland in one of the slides, I'm asking Angela if I'm really interested in the conflict of interests, and you were referring to Switzerland. And I think the situation in Switzerland is that pharmaceuticals, the multis, have to report how much money they give to doctors, but doctors, if they don't want their names on the list, they can, the names won't be on the list. So I'm really interested in how you could say that there's less doctors or more in Switzerland to get the money, to have the conflicts, because I would like to do that a long time. So and maybe you have tips to do exactly that, to maybe find other ways to find out who is behind the names or the flow of the money.
In this case, in Spain, I wasn't at Civio at that time, so maybe I'm wrong, but in the list of each pharmaceutical company, you see the aggregate transfers of money and how many people have received money. So in that investigation, Civio published the number of people that were more transparent and that they refused to be in this public list. So maybe it's an option, and they did a comparison about the more transparent doctors that agreed to appear in those lists. But I'm not sure about the situation in Switzerland because we made a comparison with the UK and Germany, but not with your case, so I'm not sure.
May I just add, because so Corrective at that time did a collaboration with, I forgot who it was, SRF. So this data exists, there's Euros für Ärzte, or it's called Franken für Ärzte. It exists, this project, it's the same. And the numbers, so just to add, so yes, we let's say Pfizer says we have given 90,000 doctors money, and Bayer says we have given 80,000 doctors money. So can you add them up? Well, no, because maybe some of them have received money from both of them. So actually, that's the thing. So unless there's transparency and you have all the names, also the pharmaceutical industry is guesstimating actually how many doctors are involved overall, just as a comment on these numbers.
Okay, thank you very much. So a big round of applause, please, to our panelists. And also a big round of applause to all of you for being a wonderful and responsive audience. To be honest, I mean, I think sessions like this restore our hope and our faith in journalism and health journalism. So thank you all very much.